Hello, I'm Helen Tunnicliffe. I'm one of the extended scope physiotherapists in Leicester, working mainly in upper limb. I'm just going to talk through how we treat shoulders in physiotherapy, moving away from condition-specific treatment, looking at treating the patient's symptoms and modifying through the stages of progression. So we're going to talk around the painful shoulders, stiff shoulders, moving on through to strengthening and cuff conditioning and through to the end stage of treatment. Okay, so starting with the painful shoulder, so patients who aren't necessarily stiff, that have range of movement but are struggling to get that range of movement due to pain. Quite often we need to support the arm, so you move the body around the arm, or change the patient's position. So we're looking to improve their symptoms, so looking to improve their range by supporting or moving the body around the arm. So gym balls are good, or you can get the patient putting their hand up onto a shelf and loading through there and taking the arm up. You can get them almost to full range of movement without having to use the muscles around the shoulder by using the legs. So you're including the kinetic chain and getting them up into this position. If that's not comfortable for the patient, then changing their start position can quite often help. So getting a patient to lie down, try them in supine. If they are struggling to initiate the cuff, then this helps to work the anterior deltoid to come up. You can get them up, and then that overhead range is then gravity assisted and it can be more comfortable. You can get them assisting the movement with the other arm and coming back down. Putting a patient into prone helps with some scapular protraction. You can get the patient reaching forwards and again reaching up, and they're more supported and taking it through range. So it's really just modifying the position of the patient and helping them to work through range in a more comfortable way. Okay, so now we're going to look at exercises for a patient to do for a stiff shoulder. Now this is for conditions such as frozen shoulder, which we do need to recover the rotational movements in order to get that end of range overhead movement. So it's a good stretch to overcome internal rotation stiffness is a sleeper stretch. So getting the patient to lie on their side, on their affected shoulder, the shoulder up at 90 degrees, elbow at 90 degrees, and pushing the arm into internal rotation, holding the stretch for 30 seconds to a minute and trying to increase from there. So encouraging the movement into external rotation. You can use body weight to overpress, putting the hand on the door frame or in a corner, keeping the elbow tucked in at the side and rotating the body and overpressing, pushing into external rotation. You can also work into combined external rotation and abduction, taking the arm up the wall and leaning, rotating the body, stretching into that position, which will also help to stretch the pecs. You can also reach up to encourage overhead movement, reaching up and leaning the body weight into it, using the body to overpress to provide a stretch to the end of range elevation.